Welcome back. British Prime Minister Boris Johnson now in the intensive care unit. His coronavirus symptoms worsening. Cabinet members in the UK say that he is not on a ventilator this morning. Here at home, the White House Coronavirus Task Force is focusing on some positive signs. They are also stressing, though, that the pandemic is far from over. Dr. Anthony Fauci weighed in yesterday.
If you want to get to pre-coronavirus, you know, that might not ever happen in the sense of the fact that the threat is there. But I believe with the therapies that will be coming online and with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now.
Joining me right now is infectious disease expert, senior scholar at Johns Hopkins Center for Health Security, Dr. Amesh Adalja. And Dr. Adalja, it's a pleasure to see you once again. I want to start with Boris Johnson and give us your take on this. We are all sending, obviously, our best wishes there. He's not on a ventilator, we understand, this morning. What does that tell you? And do you expect a ventilator to be needed soon?
It's hard to know without having access to his medical records. But we do know that people do get put into the ICU, and about half or so may end up on a mechanical ventilator. But you can be in the ICU for a variety of other reasons, meaning maybe he is on a high level of supplemental oxygen and they want to watch him to make sure that he doesn't need a ventilator. Maybe he needs basically around-the-clock nursing care that requires a nurse to be basically dedicated to less patients that are taking care of him. So there's lots of reasons that are in the ICU. Hopefully he doesn't need a mechanical ventilator. Hopefully this turns around before that time, but it is something you have to watch on basically a minute-by-minute basis when you have a patient in the intensive care unit.
So he could recover from being on oxygen, which is what we're told he's on right now. He could recover from here without needing the ventilator, perhaps. I understand you're speculating in many regards because you don't have the access to his files. Just trying to
exactly.
understand what we know
there are
so
people.
far.
I've admitted patients to the ICU that have been put on high levels of oxygen and have not needed a mechanical ventilator, and I've admitted people that have ended up on a mechanical ventilator. So it's going to kind of be specific to that patient and what their actual condition is.
So let's talk about where we are right here. There is a new study out this morning that shows that neither surgical masks nor cotton masks stop the coronavirus from spreading when someone coughs. What face covering should people be using to avoid getting any exposure to any coughs when you're next to people, even if you're social distancing?
So this is a very controversial topic in my field. And what happened was the CDC changed its guidance recently and said that people should wear a homemade mask if they go out. And that's not to protect you, but to protect you from actually spreading the virus to other people through your coughs and sneezes, which we've always said, if you're sick, you should wear a mask if you have to go out. But also, there are some people that may have mild or no symptoms and they might be able to be still contagious. And we've seen some cases of asymptomatic spread. It's unclear whether any mask actually helps with that. And there is guidance to do that. And that new study is a little bit controversial. There's just 4 patients in it. But it does tell you that this isn't some kind of panacea. This isn't some ironclad way. That really social distancing and being able to wash your hands frequently and not touch your face are the main ways to do this. And I think masks should be viewed by everybody as secondary and not the primary means for the general public to protect themselves or to protect others from this virus.
Dagan.
Adalja, quickly, are you concerned that people see these numbers in terms of the hospitalization numbers, the number of people dying from this virus? They start to level off or even go down slightly, and they get reckless in their behavior, where people feel more confident to go out, and then we have another wave of this virus hitting people across the country?
There is that danger. I think everybody is looking with hope that New York's hospitalization numbers and their case numbers will remain stable and then going down. But that isn't a reason to completely let up. That is a reason to look for hope and realize that our hospital capacity actually survived the brunt of this outbreak in New York City. But we still need to think about social distancing. We still need to make sure all hospitals in the country are able to deal with the surge of patients. We still have to work on a lot of different issues before we're able to safely be able to live with this virus in a new normal. And that's not there yet, but we're getting closer, and everything is looking better in New York.
All right, we will leave it there, and we hope that continues. Dr. Amesh Adalja, thanks very much for weighing in this morning. Good to see you again, sir. Thank you, sir.